This is Wade Griffith doing sterile wound dressing change for Nursing 101. So I'm going to do my 11 routes of medication administration, my GPSPs, going to do my 3 checks. I'm going to go ahead, knock twice, enter the patient's room, introduce myself, get their name and date of birth, check it with the hospital band to make sure they match. And then I'm going to go ahead, ask if they are in any pain, and if necessary, I'm going to go ahead and give them pain medication as prescribed. Then I'm going to ask if they're allergic to anything. If not, I'm going to go ahead and start. I'm going to go ahead and do hand hygiene. I'm going to go ahead and put on my non-sterile gloves. Alright, now that I've done that, I'm going to go ahead and remove the dressing. I'm going to do push-pull, and I'm going to use sterile saline if necessary. Around the edges first. Just push-pull method. Alright, I'm going to go ahead and grab the dressing from the center. I'm going to go ahead and assess for type, amount, color, and odor on the dressing. I don't really see anything out of the ordinary here, so I'm going to go ahead and dispose of this dressing. Alright, so now I'm going to go ahead and do I'm going to look, inspect the wound for size, appearance, drainage, and ask them if they're in any pain. I'm going to go ahead and do hand hygiene really quick. I'm going to go ahead really quickly and get my sterile drip glove package out and ready. I'm going to go ahead and take my dressing change tray, ensure it's all dated properly. Go ahead and peel that back, tuck it under. Hand hygiene. Now I'm going to go ahead and ensure that this is dated properly for the sterile gloves. It's dated properly, that it hasn't been opened, and it's not wet, it's dry. So I'm going to go ahead and open this. All right. And this is above my waist the entire time. Get your finger under here. Alright, so now I'm going to grab with my non-dominant hand, 2 fingers, pinching right here. I'm going to go ahead and get that in. And now I'm going to go ahead and tuck. I'm going to hold my thumb back and tuck fingers under here. Alright, so now I'm going to slide this hand in, step back. Thumb back. And now I've got that done, I can go ahead and pull this cuff down on this glove, like so. Alright, so now that I've done that, I've got my kit open. I'm going to keep these above my waist. I'm going to go ahead and reach into my dressing change kit and get out my swabs. And now when I'm doing this, not going to touch any edge of this container. I'm going to grab this, and I'm not going to be going over the wound. I'll be wiping it top to bottom, or also you can do from the center outwards. I'll be going top to bottom. So I've got this out. I'm not going to be going over the wound at all. Further side first. go ahead and discard that. I'll grab my next one, other way around, not going over the wound. Toss that. Now I'll be going over the center. All right, I'm gonna go ahead and discard this. And now I'm going to go ahead and wipe down with my gauze. All right. That side first. The other side. Now I'm going to go ahead, grab one more sheet of gauze out, tap down the center. All right, dispose of that, dispose of all three. And now I'm going to go ahead and dispose of these sterile gloves. All right. All right. Toss that, toss my film package. Now I'm going to go ahead, hand hygiene, get my next sterile glove kit out for my glove change. Doing the same stuff, ensuring that it is, it's not out of date, it's not wet, and it hasn't been tampered with. I'm gonna go ahead and open that. I've done hand hygiene. All right. There, pull out. Once again, keeping everything above my waist. I'm going to go ahead and pinch with my non-dominant hand. Back from the wrapper. Alright. Now I'm going to go ahead and put my fingers under this cuff. Hold it back, go ahead and insert my hand. Like that. You're going to pull this cuff down. Alright, now that I have my second pair of sterile gloves on, I've maintained sterile technique. I'm going to go ahead and grab my ABD bandage without touching the edges of the packaging for my dressing change kit. Alright, so I'm going to go ahead and place this on. I'm going to get my tape, and I'm going to go ahead and tape up here and down here, just tape it to get it secured properly. Go ahead and dispose of my tape. Now what I'm going to do is get myself a pen or whatever the hospital would like me to do, and I'm going to initial and date the bandage, or the dressing, I mean to say, and then I'm going to go ahead and ensure the bed's in the lowest position. I'm going to have the call light in there. I'm also going to have the time marked on that, date, time, and initial, little brain fart. So what I'm going to do now is I've got the bed in the lowest position. I've got the call light available. I'm going to document. Well, first I'm going to take these off. Hand hygiene. Gonna dispose of all this, then hand hygiene. Now that's all done. Like I said, their call lights available, beds in the lowest position. I'm gonna go document and chart as per hospital policy. And that's it.